You've probably heard it your whole life. That masturbation is dirty. That it's something you should have outgrown by now. That once you hit 50 or 60, that part of your life is just over, and you should quietly accept it and move on. Well, I'm here to tell you that belief is not only wrong, it's actually hurting you. Because the truth is, masturbation after 60 isn't something to be ashamed of. It's one of the most natural, beneficial things you can do for your body, your mind, and your overall quality of life. This isn't about clinging to youth. It's about choosing to live fully instead of quietly declining. It's about honoring the body you still have and treating it with the dignity it deserves. My name is Dr. Nerita. I'm a urologist with over 12 years of experience specializing in men's health. And over the course of my career, I've had thousands of conversations with men, real, honest, sometimes uncomfortable conversations about what's happening with their bodies as they age. And today, I'm going to share with you 7 science-backed secrets about masturbation that men over 60 wish they had known years ago. These aren't opinions. These aren't trends. These are things grounded in research, clinical experience, and the real stories of real patients who turned their health around by understanding what I'm about to tell you. Now, before we get into it, if you believe that men deserve to talk about their health without shame, no matter their age, do me a favor. Hit that like button, subscribe to the channel, and drop a comment letting me know where you're watching from. It means more than you think, and it helps us reach more men who need to hear this. Alright, let's get into it. Here's something I see in my practice more often than you'd expect. A man comes in, usually in his 60s or 70s, and he tells me he's lost sensitivity. Things just don't feel the way they used to. He needs very specific conditions to finish, a certain grip, a certain rhythm, a certain type of stimulation. And underneath all of that, there's almost always a layer of shame. He feels like something is broken, like his body has failed him. But here's what's actually going on. For years, maybe decades, this man has been masturbating the same way. Fast, tense, mechanical. It's not something he ever thought about. It was just a release, something quick and automatic, often paired with visual stimulation that ramps everything up to a level that real life can't compete with. And over time, that pattern trains the brain. It teaches your nervous system to only respond to that one narrow type of input. The result is reduced sensitivity, weaker erections, sometimes what we call porn-induced erectile dysfunction, or delayed ejaculation, where finishing becomes harder and harder, or impossible, without that very specific routine. And the emotional toll is enormous. Men start to feel detached, disconnected from their own bodies. Their confidence drops. They pull away from intimacy. Some even stop trying altogether, which only deepens the loneliness and the sense of isolation. But here's the good news. This is reversible. The solution isn't to stop masturbating. It's to change how you do it. You retrain your brain by slowing down, by making the experience intentional. Instead of rushing through it on autopilot, you focus on what you're actually feeling. You pay attention to sensation, not fantasy. You let your body guide the experience instead of forcing it into a narrow pattern. And over time, sensitivity comes back. Erections improve, and so does your relationship with your own body. It's like retraining a muscle that has forgotten how to work properly. It takes patience, but it works. Now, let me tell you about a patient of mine. I'll call him David. David was 68 years old. He came in complaining about getting up multiple times a night to urinate. He had this nagging ache in his pelvic area, a weak urine stream, general discomfort that he'd been living with for longer than he wanted to admit. When I asked him about his sexual activity, there was a long pause. Then he told me he hadn't ejaculated in years. Not because he couldn't, but because he thought he wasn't supposed to. He thought that part of his life was behind him. Here's what David didn't know. Your prostate doesn't retire when you do. It keeps producing fluid. That's just what it does. And when that fluid has nowhere to go, it builds up. That buildup leads to congestion, which can cause inflammation, discomfort, a weak stream, increased risk of infection, and this is important, a potentially higher chance of prostate cancer. This isn't speculation. A well-known Harvard study found that men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer compared to men who ejaculated far less frequently. 21 times. That number surprises a lot of people, but the science is clear. Regular ejaculation helps keep the prostate healthy by flushing out old fluid, toxins, and inflammatory substances that can accumulate and cause problems. So what happened with David? After our conversation, he made a change. He resumed regular sexual activity on his own, and within a few weeks he was sleeping better. His symptoms started to ease. That heaviness in his pelvis began to lift, and something else happened too. Something harder to measure. His spirit came back. He felt like himself again. He told me he felt like he'd been given permission to live fully again. Now, we don't ignore our heart health. We don't ignore our blood pressure. So why on earth would we ignore the prostate, one of the most important glands in a man's body, simply because the solution feels uncomfortable to talk about? This next one runs deep, and it might be the most important secret of all. In my practice, I've noticed something. Many of my older patients can't even say the word masturbation out loud. They whisper it. They talk around it. They use vague phrases or just avoid the topic entirely. And when I dig a little deeper, the reason is almost always the same. Somewhere along the way, whether it was a parent, a teacher, a religious leader, or just the culture they grew up in, they were taught that touching yourself was wrong, dirty, sinful. And that message didn't just sit on the surface. It burrowed in deep. It became part of how they see themselves. And here's the medical reality of carrying that kind of shame for decades. Chronic shame raises cortisol, your body's primary stress hormone. Elevated cortisol leads to anxiety, muscle tension, sleep disruption, and over time it contributes to depression, cardiovascular disease, weakened immunity, and even cognitive decline, including increased risk of dementia. Shame is not just an emotion. It's a physiological event. And when it's constant, it wears the body down from the inside out. Now, contrast that with what happens during conscious, intentional self-pleasure. Your brain releases dopamine, which supports motivation and focus. It releases oxytocin, which promotes calm and connection. And it releases endorphins, your body's natural painkillers. The result is better sleep, improved emotional regulation, a genuine sense of well-being that ripples out into every other part of your day. I had a patient, a 72-year-old widower, who came in looking like a man who had simply given up. He wasn't sleeping. His blood pressure was elevated. He described himself as feeling numb, hollow. He'd lost his wife a few years before, and along with her, he lost any sense of physical connection, not just with another person, but with himself. We talked carefully and respectfully about rebuilding that connection, about approaching self-touch not as something shameful, but as something dignified, something that honored his body and its need for sensation, comfort, and care. He was hesitant at first, but he tried, and slowly things changed. His sleep improved, his blood pressure came down, and one day he sat in my office and said something I'll never forget. He said, "I feel alive again." Let me say this clearly. You are never too old for dignified self-touch. It's not something to be embarrassed about. It's something to be embraced. It's an act of self-care, not self-indulgence. Here's something a lot of men don't realize. Testosterone naturally declines as you age. That's expected. But what accelerates that decline, what makes it drop faster than it should, is a lack of sexual engagement. When your body doesn't receive signals that sexual function matters, it starts to downregulate. It pulls back on production. It essentially says, we don't need this anymore. And the consequences show up everywhere. Muscles get softer. Body fat increases. Energy drops. Confidence starts slipping in ways that are hard to put your finger on, but you feel it. You feel it in how you carry yourself, how you show up in the world. But when you engage intentionally, when you give your body that signal, even through solo activity, something shifts. Your system responds. Testosterone production gets a nudge. And that nudge supports cardiovascular function, mood stability, and an overall sense of vitality that goes far beyond the bedroom. One of my patients, Frank, was 73. He came to me feeling like everything had slowed down. His energy was low. His motivation was gone. He described it as feeling like the engine was just winding down and there was nothing he could do about it. We talked about a comprehensive approach, diet, movement, sleep, and yes, intentional self-pleasure as part of his overall wellness. He committed to it. And over time, his testosterone levels actually rose. Not dramatically, but meaningfully. Enough that he noticed. He stood a little taller. He spoke with more confidence. He told me he felt like he'd gotten something back that he thought was gone for good. That's the power of giving your body the right signals. This one is simple, but it's critical. Your penis is a vascular organ. It depends on healthy blood flow, nerve function, and regular use to maintain its ability to work properly. And just like any other part of your body, when you stop using it, it starts to decline. When you go long periods without erections, whether from sex or from solo activity, the smooth muscle tissue inside the penis begins to deteriorate. Blood vessels stiffen. Nerve pathways weaken. And over time, that decline can become permanent. Think of it like your legs. If you stopped walking for a year, your muscles would atrophy. Your joints would stiffen. Getting back to normal would be a long, difficult road, and some of the damage might not fully reverse. It's the same principle. Your body adapts to what you do with it. If you stop using it, it stops maintaining itself. But when you maintain regular erections, whether through solo activity or intimacy, you're sending a signal to your body that this function is still needed. That signal keeps the tissues elastic, the blood vessels flexible, and the nerve pathways responsive. It's maintenance, pure and simple. It's not about performance. It's about preservation. Here's the bottom line, gentlemen. Masturbation after 60 is not something to fear, hide, or feel guilty about. It's a legitimate, valuable, and science-backed tool for maintaining your health, your confidence, and your quality of life. It supports your prostate. It preserves your sensitivity. It protects your testosterone. It reduces stress. It improves sleep. And it reconnects you with your own body at a time when many men feel increasingly disconnected. The men who thrive after 60 aren't the ones who got lucky. They're the ones who stayed engaged, who stayed curious, who refused to accept decline as inevitable. They're the ones who understood that their body still deserves attention, care, and respect, no matter their age. You can be that man. Start today. Slow down. Be intentional. Release the shame. And give yourself permission to live fully. If this video helped you, hit that like button, share it with a brother who needs to hear it, and subscribe for more real, honest conversations about men's health every week. Drop a comment below and tell me what you found most helpful or what questions you still have. I read every single one. I'm Dr. Nerita. Take care of yourselves, gentlemen. I'll see you in the next one.